Jerome Ford suffered a leg injury in last Sunday's game, and at the time there was speculation as to whether or not it was going to be a knee or an ankle injury. Adam Schefter came out and recently said that as of right now, sources are reporting that it is a low-grade high ankle sprain, and he should be missing anywhere from 1 to 2 weeks. Anytime you're going to see an injury with a rotational component going through the foot and ankle like we did in Ford's case, they're at risk for a high ankle sprain. So with this video today, I essentially want to go over the pertinent anatomy and also explain the grading system so that people can understand it. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Gallo and I'm a doctor of physical therapy. And with my channel, I take a look at sports injuries and I explain them so that they're a little bit easier to understand. I also go over the pertinent anatomy as well as what that person should expect when in rehab. If you like this sort of content, please hit that thumbs up and subscribe to the channel because I will be making more of these videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you personally have suffered one of these injuries, please go ahead and leave your feedback in the comment section below. Now we can see here in this injury video that as he's being brought to the ground, that right toe essentially seems to get stuck in the turf and he's getting a lot of rotational force going through his lower leg. So here I've got a model of the foot and ankle, and so the ankle joint essentially is formed by two long bones that are going to come down and form either side of the ankle. The first one being that tibia or shin bone is going to come down and form that medial malleolus. And then on the outside here, we have the fibula bone that's going to come down and form the lateral malleolus. Then as we look on the inside here, we have our talus bone that's going to form up the bottom portion of the ankle. And there are a lot of ligaments essentially contributing to overall ankle stability. We have them laterally in through here, and we also have them medially as well. They're going to check either those inversion or eversion motions. So I said earlier that anytime we get a rotational component going through the foot here and ankle, that's going to put a lot of strain on these high ankle ligaments and put someone at risk for a high ankle sprain, and I'm going to show you why. So on this model here, as I externally rotate the foot, you can see that as I do that, that is essentially going to put a force going through those high ankle ligaments where the tibia and fibula are going to separate. So anytime a person is going to be planted or they're getting a lot of external rotation going through that foot, that is absolutely putting them at risk for damaging one or both of these ligaments. The first ligament is known as the anterior tibiofibular ligament, and so we call this the anterior tibiofibular ligament because anterior means it's towards the front, tibiofibular meaning that it's going to attach the tibia and fibula together. Then as we go towards the back of the model here, we have the posterior tibiofibular ligament. Posterior because it's on the back portion. Once again, tibiofibular because it's going to attach the tibia and fibula together. Essentially, both of these ligaments are going to function to prevent any sort of separation between the tibia and fibula bones. Now, there are a couple examination techniques we can do if we get somebody in the clinic or on the field to determine if we think they've suffered a high ankle sprain. The first one is going to be obviously their location of pain. So if a person is telling us they're having pain more so in this upper region in through here, whether it be on the front or the back or both, that makes us think that that's going to implicate the high ankle ligaments because that's where they're located. Usually if they say that they're having pain through the bottom portion here laterally or medially, that essentially will make us think that they're not dealing with a high ankle sprain. One of the tests we can do too is basically a rotational test. So we're going to stabilize the person's leg like this, and we are basically mimicking that motion by externally rotating their foot to essentially see if this is going to reproduce their pain. If that test reproduces their pain and or they have some laxity compared to the other side that we look at, then that also makes us think that they have a high ankle sprain. But of course, the gold standard is the MRI. An MRI is going to tell us the severity of the ligament damage, and this takes us to our grading system. So in a grade 1, this is where you're getting stretching of that affected ligament. In a grade 2, you're getting partial tearing. And finally, in a grade 3, you're getting a full rupture. The fact that they're calling this a low grade high ankle sprain makes me believe that it's more along the lines of a grade 1, because also the time frame for him to return to the field is 1 to 2 weeks, which is definitely on par with what we would see with a grade 1. A grade 1 is definitely the best case scenario because you're not getting any tearing of the affected ligament. It's only stretched. So when that person comes to rehab, essentially we can be pretty aggressive right off the bat. We can start to work in range of motion exercises as long as it's not too painful for them. And we can start pumping out swelling and things with that acronym RICE, where R stands for rest, I stands for ice, C stands for compression, E stands for elevation. Then as the person starts to feel better, and it's usually pretty fast, we can start to work on strengthening and then finally sport-specific movements. Like I said, usually this takes about anywhere from 1 to 2 weeks. Sometimes if it's bad enough, can go up to week 3. But I think as of this stage, since sources are saying 2 max, that's a very good sign. If I happen to hear any updates regarding Ford's case, I'll be sure to update everybody in the comment section. Also, if you happen to hear anything, please feel free to update me as well. So fortunately for Jerome Ford, it looks like he has dodged a bullet in this case. He should make a pretty quick recovery. If you like this content, I'm gonna go ahead and link another one on my playlist so that you can basically see some of the other injuries that I've talked about. Thank you again for tuning in, and I'll see you next time.